Assalamualaikum warahmatullahi taala wabarakatuh, and salam sejahtera to all my friends and also to my lecturer, Professor Madya Dr. Masnita Misran. So today I will present about prioritizing COVID-19 vaccinations in changing social and epidemiological landscape, which is a mathematical modeling studies. Okay, so for the first of all, I will explain about their background and the introduction. For the background, during COVID-19 pandemic, authorities must decide which group to prioritize for vaccinations in shifting social epidemiological landscape in which the success of large-scale non-pharmaceutical intervention requires broad social acceptance. For introduction, the COVID-19 pandemic has imposed a massive global health burden as wave of SARS-CoV-2 infection moved through population around the world. Empirical analysis, the mathematical models has shown that non-pharmaceutical interventions such as physical distancing, hand washing, and mask wearing are effective in reducing the COVID-19 case incidence. Pharmaceutical interventions are highly desirable given the socio-economic costs of lockdowns and physical distancing. Dozens of vaccines are in development, and model-based analyses are exploring the question of which groups should get the COVID-19 vaccine first. So we go to methods. There are 4 methods that I can explain to you guys. So for the first method is the model structure and parameterizations. We develop an age structure SPARE, which is stand for susceptible, exposed, pre-symptomatic, asymptomatic, symptomatic, and removed. Model with age in 5 years increment. We did not explicitly model testing or contact tracing, although we assume affected individuals are ascertained at some rate. Transmission occur through an age-specific contact matrix. Susceptibility to infection is age-specific, and we include seasonality because of change in contact patterns throughout the years. For the second method is the statistical analysis. To infer model parameters, we use a Bayesian particle filtering approach to the fit model to Ontario COVID-19 case notifications is stratified by age and time. Ontario seroprevalence data and Ontario mobility data. Using seroprevalence data ensure that our estimates of transmission were not based by case underreporting. Remaining model parameter values were fixed with use of Ontario demographic and mortality data and literature on COVID-19 serial interval and incubation period. So next, go to the third method is a non-pharmaceutical intervention scenarios. Both school and workplace are closed when the number of ascertained active cases surpasses 15%, 100%, 150%, 200%, or 250% of the peak ascertained active cases that occur during the first wave is the shutdown threshold and are reopened again when cases fall below the threshold. We use social learning dynamic derived from evolutionary game theory to model individual adherence to non-parasitical intervention. Individuals interact with other individuals at a specific rate and which between adherence and non-adherence to non-parasitical intervention, including mobility restrictions. And for the last and the fourth method is a vaccine scenarios. We consider two dates for the onset of vaccination, which is 1st January and the 1st September 2021. This date correspond to the end date of the 2-dose course of vaccinations lasting 2 weeks. We assume it was possible to vaccinate 0.5%, 1.1%, 1.5%, 2.5%, or 5% of the population per week, which is the vaccination rate. Our baseline scenario assumes a vaccine with 75% efficacy in all age against both disease and transmissibility. So next is result. So what we get the result from the method. So the model reproduced 2 or more pandemic waves from March 2020 onward, not only with respect to COVID-19 cases, but only populations adherence to non-parasitical intervention and periods of school and workplace closure. The effect of 4 vaccination strategies on COVID-19 cases and COVID-19 related death depends on when the vaccine becomes available and how quickly the population can be vaccinated. We identify 3 regimens for model dynamics and explore them through plots of infection incidence over time, percentage reduction in mortality under all 4 strategies. For the first regime is vaccinations start on 1st January 2021 and the vaccination rate is relatively high, which is more than equal 1% of the population per week. For the second regime, either vaccination start early on 1st January 2021, but the vaccination rate is low, less than and equal 0.5% of the population per week. And the third regime, vaccination rate late for the 1st September 2021, and the vaccination rate is relatively low, less than or equal 1% of the population per week. So for the discussion, our social epidemiological model suggests that if a vaccine against SARS-CoV-2 becomes available sufficiently late in pandemic, use of such vaccine to interrupt transmission might prevent more death from COVID-19 than use of the vaccine to target those aged 16 years and older, depending on when the vaccine becomes available and how quickly the population can be vaccinated. These results are driven by the fact that the vaccine might only become available after population have had one or more with immunizing infection. As a result, the effective reproduction number of Google as a result, the effective reproduction number, the Google mobility data that we use as a proxy for adherence to non-pharmaceutical intervention closely mirror the COVID-19 case notification data over the period using for fitting. The fit of the social submodel to mobility data is as good as the fit of the epidemic submodel to case notification data, despite the fact that our social model consists of sustainability, sustainability favor equations and a similar number of parameters to that of our epidemiological models. So the model was parameterized with the data from Ontario, Canada. The projected effect of the 4 vaccine strategies might differ in setting with different epidemiological or social characteristics. So that's all from me. And for the last one, I want to say that to all Malaysian, please be safe out there. And if you want to go to outside to buy something, please wearing the double masking, which is you wearing like a transparent mask and also the cotton mask or the blue one. So if you want to go to nearest person, please be avoid or stay in the 1 meters. So these tips will help you guys to avoid from the COVID-19, and also please follow the SOP. To make sure you and your family or your member will be safe. And trust me, we will win. Fight COVID-19. So that's all from me. And thank you for listening my presentation. And Assalamualaikum warahmatullahi taala wabarakatuh.